What's going on, guys? Welcome back to W.D.Y.D. CSP. What do you do as a central sterile processor? Part 2 of complex surgical instruments, those robotics. Stay tuned. Alrighty, guys, as promised, part 2 of those robotics. We are in prep and pack with our robotic instrumentation. Guys, all right, so this came out of the washer, and if it came out of the washer, that was set up correctly to process your arms. There's no need to, you see a lot of facilities hang these to drip dry them, things of that nature, I'm not even gonna get into the air guns over in the clean side. Love them or hate them, because there is no real guidance on them. I have seen many air guns on the clean side, but we're not going to get into that. But you can put this into a warming cabinet, allow it to dry fully if you're shaking it, and you're seeing excessive water come out of it. You shouldn't if your washers are functioning correctly. So what are we doing over in the prep and pack side with this instrumentation? Well, again, we're doing our inspection. Okay, we're making sure that the housing is not cracked. You want to make sure that there's no separation between the base and the housing. Functional buttons here. Okay, these buttons need to function. You're looking for that infamous red dot. If that red dot's there, that means that this is out of lives, all right? If you have this on a tracking system and you're scanning this in and it shows that it's been sterilized X amount of times and it's reached its life of sterilization, then again, this instrument no longer is able to be processed, so you should be discarding it properly. But if you can further use it, all right, the usage you're in. Okay, you're looking at the cog wheels here. You're making sure that these wheels function and that it's moving moving the distal tip there. All right, it's moving along finally, opening and closing. All right, there should be that many wheels on there. Some of them look like there's a wheel missing, but it's not. Trust me, there's not. Again, any cracks in the housing, you want to look for separation between the base and the shaft and the actual base. Okay, if you can see the white inner tubing in there, this is a bad connection, all right, because this does come apart, guys, so you shouldn't be able to take it apart. All right, you're going to feel along the shaft for any cracks or any rough edges or cuts or nicks. Like you'll see right here, there is a little sharp edge there that I can catch my nail on. That's not bad. It's almost like a fiberglass, but you want to make sure that that's not sharp or catching on anything, because you don't want that scraping in the inside the trocar when they're placing it down the trocar. You don't want that shaving off into the patient. All right, so this distal tip here, all right, this is when you get your handy dandy magnifier out, guys. So you want some good lighting. Okay, you want some good lighting. So I got my good light bulb here, and let me see if I can turn this light up a little bit, a little intensity. All right, so you want really good lighting, and your magnifier doesn't have to be super bougie. It don't have to be one of them big fancy schmancy magnifiers, but you do want a good magnifier. So this little tiny thing right here is actually a 10 times magnifier, guys. Y'all see that? Can y'all see the magnification on that bad boy? Yeah, I got some bad cuticles, don't I? You know what I mean? That magnification is good 10 times. So what you want to do is get this under lighted magnification here, and you want to look at those stainless steel cords in there. There's stainless steel wires in there, guys. You want to look for fraying, all right? Any breakage in there. Of course, you definitely want to look for some bioburden up in here. All right, so you're magnifying there. You're looking really good under some good lighted magnification. I mean, you want to look with your naked eye first, but always go to your, especially with something this delicate and small, get your magnifier here, magnify, look really good at those cords. Look for that fraying, look for any bioburden entangled in there. Okay, you want to be real good. You want to look at the connections where it pivots. You want to make sure that there's no cracks between the actual joints and the pin. Okay, so you don't want to see no cracks in there. Okay, so there's a lot of complex pins in there. All right, so once you inspect that, you're looking good there. You're looking good right there. Everything looks great. No bioburden. Okay, up to the jaw, you want to look at what's called the box lock area in here. There's actually a pin connecting. So you want to make sure that there is no cracks where the pin and the two halves of the jaw meet. Okay, so no cracks there. Everything is looking fine. So far, so good. Now you want to inspect that jaw. Careful inspection of the jaw for any bioburden, any bending, any damages to there. Of course, you want to bring the jaws together, okay, as I just did right now. And you want to make sure that the jaws actually close. All right, so at the distal tip, you want to make sure that the jaws are really nice and closed and it's tight, that it's actually closing there and actually grasping tissue like it's supposed to do. All right, it's looking good so far. So far, so good. My visual inspection, naked eye, and enhanced magnification and visual inspection has passed. All right, my instrument is clean. My instrument is good. My instrument is ready to go. According to the IFU, there are some lubrication points that you must do every time this instrument is processed. All right, so where are those lubrication points, guys? Well, on the jaw of this specific instrument, okay, it's everywhere where it pivots. 1, 2, okay, that's a pivot point. Okay, you got another pivot point here. 3, 4. Then you have the jaw. 5, 6. 6 lubrication points. Can you use the instrument milk to do the lubrication? According to the IFU, you're supposed to use this oil-based Steri 1 type, which is precise drops on there. Okay, so you want nice, precise drops on each side. So 1 drop. Can you use the instrument milk? I've had some vendors say yes, some vendors say no. The IFU specifies a specific lubrication that you want to use in there, and it's in like a small bullet point. If I can remember, again, I don't have the IFU in front of me, so I apologize. If I'm incorrect, please let me know. But the best way to apply a lubrication like an instrument milk is not just to spray crazy on there. Pour it into a small little cup, get a syringe, draw it up with a syringe, and I'm going to show you guys right here. This is actually an unopened lubrication here. I don't actually really want to open this, but I'm going to show you guys right now. You want to make sure you shake that up real good, because the IFU of that tells you to shake it up real good. Grab your nice little syringe, right? And it's 1 little drop. Watch, guys. 1 little drop. Bam. 1. Bam. 2. Okay, next point. You got right here. You got the pivot points right here. 3. 4. 5. And 6. Okay. You want to work that in and manipulate it really good, guys. Okay, work that in. Okay, with this here, by the IFU, it tells you, let's see, on the IFU of this specific instrument is, let's see, see, his instrument, it doesn't tell you anything about drip drying or anything like that. Some of them ask you to drip dry for 3 minutes. This one is allow it to penetrate for 30 seconds and then test the action. So you want to just allow this is okay to go through the sterilizer like so. This is ready to go, guys. So whether you peel pack it or wrap it, just don't forget those indicators. But that is how you process a robotic arm over in the prep and pack side. Guys, again, thank you for watching. I may have skipped a few steps because, again, I don't have that IFU in front of me, and I'm going to keep it real. I've never memorized an IFU in my life. I don't have any of them memorized. I always have to refer to the IFU because I may forget a step. But anyway, guys, thank you for watching. Join me next time. As always, stay true to yourselves. Keep it 100. Peace.